And without getting too far into the technical side of it, we were talking last show about hormones, and the fact is that as you gain weight and you have a disproportionate amount of fat, it does distort the way your body responds to things like insulin or thyroid hormone.
And leptin.
And all the different things that our bodies need to regulate intake and metabolic processes. So you end up with something like an aberrant blood sugar because you don't respond to your insulin appropriately, and that then causes other changes because cells aren't used to it and they aren't responding to it the way they normally would. You start getting the inflammatory changes, you have the atherosclerosis and the progressive coronary disease, the blood vessel disease, and all the things that you were talking about with free radicals that has to do with a disturbed metabolic process.
Yes, absolutely. Insulin itself is an inflammatory hormone, and abnormal, what we call insulin signaling, is a major part of diabetes and overweight states. Insulin itself is a fat storage hormone. So one of the strategies that has been used for pre-diabetics and diabetics is a so-called hypoglycemic diet, a low glycemic index diet. And what that is a low insulin stimulating diet to keep insulin levels low. And for many years this was controversial, but interestingly enough, the American Dietetic Association has finally, in their newest guidelines for type 2 diabetics, has finally acknowledged that for type 2 diabetics, the so-called low glycemic index diet is appropriate because it does suppress insulin, it does reduce the resistance to fat loss, and it seems to help diabetics lose more weight. So this is now clearly finding its way into many, as far as the validity of this theory, many scientific papers and writings.
So, and the glycemic sugars are those sugars that are digested and absorbed rather quickly and give you a rapid surge in your blood sugar.
Correct, and it's indexed to a teaspoon of sugar essentially. So the way it starts is it starts with indexing how fast does a teaspoon of sugar get into your bloodstream and what type of insulin response that elicits. And so if food similarly elicits that insulin response, it's given the index closer to sugar. So for example, the lactose in milk, which is a disaccharide, has a glycemic index almost identical to sugar. So that's a high glycemic index food. So that's something you would probably not want to take a lot of if you were diabetic. But a piece of chicken has a very low insulin stimulatory value, so that's a low glycemic index food.
And there are different carbohydrates that are much higher or lower than others.
Right. And a lot of it has to do with the fiber content. So one of the reasons, one of the worst foods going are the highly processed foods. So those little things you put in your toaster in the morning that pop up and they taste great, they have no fiber in them and they're purely processed carbohydrates, and that is essentially eating pure sugar. Even though it's not sugar when it goes into your stomach, it's converted rapidly to sugar. Those have no fiber, and what happens is the rate of the sugar absorption is so fast, it raises the insulin levels also fast. If you take the same amount of carbohydrate and you kind of bind it with fiber, so for example, an apple has a lot of fiber as well as carbohydrates, but it's not a high glycemic index food because the fiber in the apple prevents or slows down the rate at which blood sugar rises after you eat an apple. Hence, insulin levels are not as high when you eat an apple as opposed to the things you put in your toasters in the morning.